Hi, let's talk about a very growing true problem in this world, that is subfertility. Subfertility or not having children is one of the biggest growing problem all over the world. 1 in 8 couples are struggling every part of this world to fall pregnant and to have a child. One of the basic things that has to happen to have a child is ovulation. So a woman has to ovulate in order to fall pregnant. So let's first understand the basic of what is ovulation. Ovulation is where, simply put, is when an egg or an ovum is released from the ovary. But this process is simple, but it takes so many things around it to happen. So let's go back to the ovary. So as I mentioned earlier, when a female little baby girl is born, she is born with millions of eggs in the ovary. With time, every month after she starts menstruation, after she starts puberty, when she menstruates, all these eggs are used up little by little. Initially, the same hormones that always works, which is our pituitary in the brain, the ovaries, they all talk about the ovaries, and then these hormone cycles stimulate the ovaries to recruit follicles. So the little follicles, about few of the follicles will be initially recruited, and then one of them will start to grow, which is what we call as a dominant follicle. One follicle grows to a certain size, and again the hormone changes occurs, and this follicle ruptures. The rupture of this follicle is ovulation. By rupturing, then the egg or the ovum is released. At the time, if the sperms are around, fertilization occurs. Usually the ovum is alive for about 24 hours. So you can imagine how crucial this meeting of the sperm is in order to fall pregnant. Though this ovulation happens in most of the women, there are lots of factors that disturb it, that encourage it, and that has its own influences. Even the simple stress, the life stress has an effect, hormones have an effect, the number of eggs you have has an effect, your body weight has an effect, your normal day-to-day activities has an effect. So many things have effects in this process of ovulation. So you can imagine the ovulation has to happen as a basic fundamental rule for a woman to fall pregnant. And this is what we call as ovulation. So now we know what is ovulation. When does it occur in our cycle? So if you take our cycle, a 28-day cycle, usually ovulation occurs in the mid-cycle, which is 14 days before. Around the 14th day of your cycle, you will be ovulating. But it doesn't work for every single woman because everyone has a different cycle length. But usually the ovulation will occur 2 weeks before your menstrual date. So even if you have a 35-day cycle, 40-day cycle, 26-day cycle, ovulation almost always will happen 2 weeks before the time you would menstruate. So you would have to think the right time for fertilization or the good time for fertility will be the time that you will be ovulating. If you have a cycle length, you need to study your cycle length first, at least for about 6 months. So you'll have an idea about what sort of a cycle you have. Then you will know 2 weeks before the time of your menstruation is normally when you would ovulate. That will be the normal time you would need to have sex if you are planning to have a baby. So that will be the time that is the most fertile time of your cycle. There are some women who might not be ovulating at all, that we call as anovulation. So the anovulation happens due to many reasons. Usually it's a hormonal reason for the ovulation not to happen. So everything I spoke to you about how and what would lead to an ovulation doesn't happen. So the women might have regular cycles, but they might not be ovulating. Hence, that becomes a reason for not falling pregnant. In future, I will be discussing more topics of why a couple don't fall pregnant, how can we rectify, how can we investigate, and how can we make these couples fall pregnant. Thank you.